Hey, what's wrong?
My patients hate me. They don't listen. They don't trust me. Why do I suck at my job? How many times have you had these thoughts running through your head? As a new grad provider, you feel like you're constantly walking on eggshells around your patients because half the time you don't really know what you're doing, and most of the time you feel like you're doing everything wrong. And that's why your confidence level is so low. To build your confidence as a new provider, you first need to learn how to speak to your patients and how to establish your authority as a medical provider. And that's what we're going to talk about today. So let's dive in. Every single patient you see is in front of you with a specific intent. They came here for a reason, and it is your job to determine what that intent is and how it aligns with evidence-based medicine. So how do you do that? Well, first, you have to establish your authority as a medical provider by introducing yourself. To start, you say, "Hi, I'm Sam, I'm the PA, I'll be your medical provider today. What brings you in?" Simple, straight to the point. Then the next step is crucial. You stop talking. You listen. Listen to what your patient is saying. Give them 1 to 3 minutes to address their issues uninterrupted. Because the biggest complaints that patients have against their providers, "She didn't listen to me." So shut up and listen. Listen to what the patient is saying. Repeat what you heard back to the patient. Check in with the patient to ensure that your reflection is correct. You see, the element here is time. You need time to build trust with your patients. Time for them to speak, time for them to be heard, and time for them to be seen. Time to create a relationship. Patients have a high level of trust if they think they've been given enough time to speak to their providers. And trust is the only thing that separates a good provider from a bad provider. And it is also the number one reason that determines if your patient will file a lawsuit against you. So the higher level of trust between a patient and a provider, the less likely a lawsuit will be filed. And now that you establish yourself as a medical authority and you've kind of gained your patient's trust, you need to establish your intention for that visit. So let's give you an example of an intent. You have a patient, he's a 35-year-old male who presents with back pain for 1 week after lifting some heavy furniture. He comes in with an intent to get an MRI. Now, if you make it very clear that your intent is not to order an MRI, your patient interaction will fail because your patient will complain and say you weren't listening. And just like that, that trust that you established is already out the window. Instead, you should make it very clear that your intent is to help him feel better, and that may or may not include ordering an MRI. You should explain your assessment and plan and explain the expected course of action to improve his pain over the next few days. And then explain when an MRI is warranted and why an MRI isn't recommended at this time. And just like that, this brings us to tip number 2. The second tip to building confidence as a new grad provider is to involve your patients in the decision-making process. As a provider, you should always be honest and transparent with your patients. And when it comes to creating a treatment plan, present your patients with options. Everybody likes options. This is plan A and this is plan B. Give them all the pertinent information they need to make an informed decision, and then give them the autonomy to manage their own health. And yes, your patient may not have extensive medical training, but they are smart and capable of grasping hard concepts and making tough decisions. And for most patients, when they're given autonomy and their choices are respected, they are satisfied regardless of the outcome. Now, you can definitely disagree with your patients and express your concerns and why you might choose plan A versus plan B, but ultimately you should allow them to make the final decision. The next pro tip is to realize that your job is just a job, a J-O-B. So don't take anything your patient says or does personally. It is not you, it's them. When your patients decide to refuse treatment or change a treatment plan, let them. Don't get fixated on what you want for them. You are their provider, not their mother. So focus on things that you can control and let go of things you cannot control. Sometimes a patient isn't going to want any of the options you offered, and that's okay, because in that case, you don't close up shop and say my way or the highway. You simply negotiate with them and come up with a reasonable plan. For example, in primary care, I have a ton of patients who reject blood pressure or cholesterol medication. And these patients think that all prescription drugs are poison and they shouldn't rely on a pill for the rest of their life. And most of the time I agree, but for some very sick patients, medication is definitely warranted in addition to lifestyle changes. So I approach the situation with empathy and compassion. I start with, listen, I hear what you're saying, and I want to work with you to address this issue. And this is where I take control of the visit. And I start talking with my PA hat on. I explain why the medication is necessary. I explain the risk and the benefits. And then I explain their risk for a cardiac event and how this medication will reduce the cardiac risk. I also come up with a 6-month plan to start them on the medication and slowly wean them off the medication if they can prove that they will quit smoking or lose weight or significantly change their lifestyle. And then I wait. I allow them to speak. And if they're still hesitant to start medication therapy, then I surrender. I said, okay, I know you don't want to take the pills, but what are you willing to do instead? How about we revisit this topic in 3 months? In the meantime, would you be opposed to adopting a healthier lifestyle? And most time, your patient, they're not opposed to anything because everybody wants to be healthy. So you give them very specific guidelines. You tell them to track their daily dietary intake, their weight weekly, and their exercise regimen weekly. And you follow up in 3 months to track their progress. And honestly, sometimes they aren't willing to do anything. But again, that is their choice. That is beyond your control. And sometimes the only thing you can do for them is to let them know that you're still here if they change their mind. So always leave the door open for patients to return when they are ready. The next step is to meet your patients where they're at. We may have explained the course and prognosis for sciatica a million times, but for this patient, it is the first time hearing those words, sciatica. So don't be afraid to draw or pull up anatomy slides on Google or show the patients their x-ray or copies of their labs. And a lot of EMRs have integrated this feature where they have a graph of a particular lab value over time. Sometimes just seeing that graph of how the A1C has been slowly climbing is enough of a visual for a patient to grasp the importance of changing management. Patients also love to look at an x-ray or diagnostic image of themselves because it's very satisfying to be able to see what is being discussed even if you aren't really sure what you're looking at. And remember, meeting patients where they are mentally and educationally is critical, especially for patients who don't have a clear diagnosis. These patients often feel marginalized or unheard despite having a massive workup. I've seen patients who have literally had every test done on earth, and when you ask them what kind of treatment they've had, they'll say nothing. They haven't done anything for me and I'm still suffering. And not having a diagnosis is one of the most single frustrating situations for both patients and providers alike. And it's okay to admit to your patients that while medicine is remarkable in so many ways, there are still so many things we don't know. It's also important to focus on what we do know and not what we don't know. So we know that this patient has X, Y, and Z symptoms, and you can help manage those symptoms to the best of your ability. So frame your management as a tailored medication regimen that requires trial and time. And honestly, your patient will appreciate that, even though they don't have a definitive diagnosis, because you have a treatment plan with expectations of symptom management. The next tip is simple. Follow through. Nothing shatters a patient's confidence in their provider more than failing to do what you said you would do. Whether it's a prescription, a sick note for work, a referral to a specialist, or following up on a lab. Sometimes you just miss one, and when that happens, you apologize. It's okay. Take responsibility immediately and work to rectify the situation. It is not your MA's fault, it's not your nurse's fault, it's nobody's fault but your own. So if you miss a prescription, call it in, like right now, before you forget again. Because we're all human, we forget, we misplace, and we're busy. Patients can be incredibly understanding if you're honest about your mistake, so own it. And on that note, call your patients to follow up if you're unsure about a diagnosis or a treatment plan. You'll gain so much confidence and brownie points from these calls because based on the feedback that you get from your patients, you will 1, confirm if your diagnosis is correct, and 2, if the treatment plan is working, and 3, which is most important of all, you'll get a, hey, thanks for checking up on me. I really appreciate that. Your patient will feel incredibly grateful that you took the time out of your day to reach out to them. And more than likely, they'll praise you for it. And this will make you feel all warm and fuzzy on the inside. And you feel like a real provider. And feeling like a real provider makes you a real provider. So there you go. That is our 5 strategies for building confidence as a new graduate. When done correctly, these strategies will help you establish and maintain a therapeutic patient relationship. If you got any value from this video, please hit the subscribe button and check out our other videos about dealing with coworkers, nailing an interview, investing your hard-earned money. So there you go. You've got it all here. Sam and Go's YouTube channel. Thanks for watching, and I'll see you next time. Bye, guys.